Hello everyone, my name is Claudia Perez and I am part of the jury regarding the case of the patients at AU Bright Smiles versus AU Bright Smiles. Today's date is January 21, 2017. After hearing both sides, the plaintiffs and the defendants, I must say that both parties have great points and views regarding their sides and explanations for them as well. What I understood from the plaintiff's argument was that she felt like she was being violated in regards to her personal health information not being kept private. She argued how strongly she feels about AU Bright Smiles misusing her personal records. The first thing that caught her attention were the red stickers on the patient files labeling herself and the rest of the patients as having AIDS. Besides that, she overheard the staff of Bright Smiles talking about her disease out loud and not being private about it, which made her think that other patients would also be able to hear about her private medical information. Any medical disease, or personal information for that matter, is private to oneself unless that individual wants to share their information themselves or gives permission to others to do so. The patient's protected health information includes the details of a provider collects regarding the patient's condition, treatment, or payment that identify or have the potential to identify the patient. The patient's protected health information is confidential by the Health Insurance Portability and Accountability Act, also known as HIPAA. The right to privacy is guaranteed by HIPAA and healthcare providers have a duty to provide such privacy to patients. In regards to this case, herself and the rest of the patients were, as she called, violated in this way. The defendant of AU Bright Smiles agrees that the office failed at keeping the information of the patients privately as it should have been, violating HIPAA, and also did wrong in labeling the files with the red stickers. However, the use of the red stickers on the patient files was for the intention of the provider to know how to handle patients properly in regards to their bodily fluids and the staff protecting themselves from coming in contact with their blood. Pathogen standards, as mentioned by the defendant, do require for healthcare employees to be notified when patients have AIDS to be careful when coming in contact with such patients and when handling their blood and bodily fluids. When deciding which party to rule in favor of, I took into consideration the statement by the plaintiff of taking into account her pain and suffering, emotionally that is, that this whole issue and process has cost her. With this being said, I take the side of the plaintiff and rule against the defendant. AU Bright Smiles should have kept their professionalism and correct operating procedures to avoid any violation of any patient regarding their information. I do understand that some standard medical information is needed to go to the dentist appointment as such: name, date of birth, phone numbers, and emergency contact information, dental history of the patient, clinical examinations, diagnosis, treatment plans, documentation of informed consent, and medical history. Within the patient's medical history, a thorough investigation is written to at least include the name and phone number of the physician, the dentist's own evaluation of the patient's general health and appearance, a list of systematic diseases like diabetes or hepatitis, any ongoing medical treatment, any bleeding disorders, drug allergies, smoking and alcohol history, any cardiac disorders, relevant family medical history, pregnancy if it applies to the patient, and physical and emotional tolerance for procedures. Now, this means that the patient must disclose any disease such as AIDS in their medical record. However, it is the duty of the healthcare organization to keep and maintain such information private at all costs. A very easy way AU Bright Smiles could have taken into consideration to avoid the HIPAA violation of the patients is to have used electronic health records instead of written ones. When utilizing such records, all of the patient's information is inputted and kept in the computer. This makes the process easier and safer. When a patient arrives at the office, they will not be able to see the records being used or read at that time, since the patient will not be in front of the computer and will not be able to see the records. The dentist or any healthcare professional should be cautious when coming into contact with bodily fluids of patients, because any patient might have a contagious disease and not stated in their health record, as opposed to the patients in the dental office that did. Another precaution that could have been used by the staff at AU Bright Smiles is making sure that all patient files are kept out of view from others, especially in the reception area, which is also a violation of HIPAA. The staff was not being professional in using the information of the patient for conversation purpose, and not making sure they were being private about it either. I hope the rest of the jury sees the mistakes made by AU Bright Smiles and rules in favor of the plaintiff as I have. Thank you very much, and I hope you all have a great day.